Hi, I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic, and I want to talk to you today about why low back pain is so common. This is a question that's plagued a bunch of health practitioners and people like you and your friends. Why is back pain so common? What's the deal with this? Is it because we're lazy? Are we not exercising enough? Or our job's too demanding on our back? Well, here's some quick facts about it. Is 70 to 80% of people will have back pain sometime in their life that requires some sort of treatment. Back pain is actually the most common cause of activity limitation in people less than 45 years old. Now, what's the deal? Why is it so common? Well, one of the reasons is we started out walking on 4 legs, right? Then we ended up standing up. Now we're just on 2 legs. With that, the spine carries more load because it's vertical as opposed to just being horizontal. So there's more load into the back because of that. It's just simple physics. We also take these 2 front legs, which are now arms, and we're carrying stuff and we're lifting stuff, so that's even extra weight into that area, especially if you're carrying stuff in improper ways, you're lifting improperly. The anatomical supply to the discs in your spine starts to diminish after you're 30 years old, so this makes healing very difficult because there's no blood flow going in and out of the area. I'm sure you've heard of herniated discs. There's some risk factors, just like with everything, for people who experience low back pain, especially chronic back pain. There's psychological stress that's associated with the fear of injuring your back again is a risk factor. So the best thing you can do is know what causes back pain and what prevents back pain so that you can practice those habits. You can prevent the back pain from coming back. Believing that the pain means that you shouldn't be going to work anymore is also another risk factor for recurring back pain. Believing that time or treatment's not going to resolve the back pain is also another thing that can cause recurring back pain to keep happening. The inability to just be proactive, start stretching, doing your exercises, getting your cardio in, doing your weight-bearing exercises too. And depression and anxiety can also actually affect your low back pain because of usually when you're depressed or you have anxiety, you have poor posture. And so that's going to cause an issue too, and it's also going to prevent you from going out and exercising. So it's important to look at the whole body approach with the low back pain. Look at the mind, look at the body, and look at what we're doing with our bodies. It's very important to do a lot of education when it comes to low back pain. So keep yourself up to date. If you do experience a lot of low back pain, you can go ahead and give me a call or your local chiropractor if you're not in my area, and talk to them about what is going on and see what they can do for you. Other than that, check out all my videos. There's a ton of tips on how to manage low back pain, all for free. Go ahead and watch all of them and do them. That's the most important thing. So I'm your San Jose chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. Thank you so much for watching. Bye.